Magandang araw po muli. Tayo po ay magpatuloy sa ating pag-aaral. Ang ating pong muling topic ay ang swe or blood number 4. Na po tayo. So, yung blood-chi relationship po. So, blood is form of chi. Ito po ay very dense. Chi is yang if compared with blood. Kasi yung yang, di ba siya yung sa ano ng movement. So, more subtle. So, yung blood po is yin if compared with chi denser. Chi and blood are inseparable. So, nutritive chi circulate with blood in blood vessel. Yung mga kinakain po natin, nagiging blood at yun ang sinacirculate. So, after massive loss of blood, sign of deficiency, makikita po natin yung sweating, nawawala ng paghinga, breathlessness. Tapos nalalamig po yung kanilang mga limbs. Yung pag nawawala po yung loss of blood. After prolonged and heavy sweating, yung sobra pong napapawisan na, no, yung mga nag-gym. So, pwede pong ma-deplete yung chi. Sign of blood deficiency, nagkakaroon ng pallor, numbness, dizziness, and palpitation. So, yan po yung ng relationship between chi and blood. Si chi po ang nag-generates ng blood. Si chi din ang nagmumove ng blood. At si chi din ang nag-hold ng blood. Kaya napakahalaga ng chi. Siya po yung component ng blood, hindi sila pwedeng maghiwalay. Si blood ang mother of chi. So, yung relationship na iyan, si chi ang commander of blood kasi siya ang nagkukuman sa blood na dadaloy siya sa ating katawan. Then, si blood naman, mother of chi. There are 4 aspects to blood-chi relationship. Chi generates blood. Chi generates blood and so far as food chi is basis for blood. So, yun, pag kumain tayo, nagiging food chi, food energy. Then, silang chi is essential for production of blood. Kasi alam naman natin na yung hangin na ating hinihinga, magkukombine dun sa food na ating kinakain, yun po yung nagiging blood o yung zong chi. If chi is deficient, kung mahina ang enerhiya o chi, siyempre yung blood will eventually also be deficient kasi nga magkasama sila eh. In practice, it is necessary to tonify chi in order to nourish blood. So pag ganun po, papalakasin mo yung chi para ma-nourish yung blood. Okay. Chi moves blood. So chi is motive force for blood. Kasi nga ito yung lakas ng ito yung enerhiya na nagsasabi dun sa blood na kailangan dumaloy siya sa mga ugat natin. Without chi, blood would be inert substance. So nutritive chi is very closely related to blood and flows within a blood vessel. Kasi nga yung nutritive chi, ito yung nagiging blood. At yung blood, andun yung chi na lakas para dumaloy sa ating katawan. So yung lang chi naman infuses necessary chi into blood vessel. Chi moves blood. When chi moves, blood flows. Yan. Kaya kung mahina yung chi, nagkakaroon ng stagnation. Hindi rin makakadalo yung dugo. Kasi yun yung lakas ng dugo, yung chi. If chi stagnates, blood congealed. Siya nga na po yun Pag mahina ang chi, nag-stagnates, makakakita tayo ng mga pangingitim. Sa dila, nagkakaroon ng purple color. Sa katawan, meron tayong makikita na yung mga parang nangingitim, nagbubukol-bukol, makikita po natin yon. If chi is deficient or stagnant, it cannot push the blood, which will stagnate. So, chi holds blood. Chi holds blood in blood vessel, thus preventing hemorrhages. Kaya kung mahina po yung chi, siya yung makikita natin yung ating mga veins, may mga lumalabas na pasa-pasa na parang namumula siya. Siya po yun, isang sample doon na yung chi, hindi ma-hold yung blood. So, spleen chi is deficient, chi cannot hold blood kasi pangunahing gawain ng spleen ay i-hold ang blood sa blood vessel. So, and there may be hemorrhages. Si kidney naman po, chi plays important role in keeping blood in uterus vessel. Si kidney ay para sa uterus. Kaya kung mahina si kidney chi, nagkakaroon ng sobrang pagregla or yung mahabang na panahon ng pagreregla at masakit na pagreregla. Siya po yun yung mga nagiging effect kung mahina ang chi. Kasi siyang tagapagbigay lakas sa blood. Blood nourishes chi. Whereas blood relies on chi generating, pushing, and holding action, chi relies on nutritive function of blood. So blood affects chi in two ways. Yung chi relies on blood for nourishment. Siyempre, kasi nga nandun siya sa blood, kailangan marami din yung blood, malusog yung blood, tama yung supply ng blood, para si chi, ganun din siya. Blood provide materials and dense bases which prevent chi from floating and giving rise to symptom of empty heat. So, basta yung magkasama po lagi yan. Pag mahina yung isa, mahina rin yung isa. Blood essence relationship. Blood and essence mutually affect each other. Each can transform into other. Essence plays important role in formation of blood. Kasi di ba yung essence nga, bago nagiging blood na dinidistribute sa buong organ, si essence, yun, co-combine siya. Yung essence na yan na nakatago dun sa ating energy, ay sa kidney. Blood continually nourishes and replenish essence. So kung maayos po yung pagkain natin na nagiging blood, nare-replenish yung essence na nasa ating kidney. Kung konti ang kinakain natin, konti ang nagiging blood, hindi nare-replenish yung essence na nasa kidney. Blood pathology. So, there are 3 basic cases of pathology of blood. Ito yung mga nagiging diseases pa, no? Blood deficiency. Kung kulang ka ng dugo, namumutla ka. Yan, nakikita natin sa tongue, siya yun yung mga pale. Pag nagkakaroon din ng blood heat, pag nakita natin sa tongue, yung red, mga red. Pag may blood stasis, siya po yun yung mga nagpa-purple na yung tongue. Okay po. Thank you.
Thank you very much, Ma'am Mildred. Any questions? Okay, so we proceed to tongue diagnosis. Let's welcome Ma'am Teresita Sumile. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector, at sa lahat na po. Welcome po sa tongue diagnosis. Now let's talk about relationship between tongue, body color, and shape. The color and shape of the tongue body are very closely linked and should not be considered in isolation. Together, they reflect the strength of normal qi or zeng qi. In general, tongue body color shows, with the exception of acute illnesses, underlying pattern of disharmony in a person's constitution. A pale tongue body may indicate kidney yang deficiency, while a dark red body indicates kidney yin. If there is strong contrast in color from a healthy pale red tongue body, this reveals onset of a more serious illness involving the internal organs. Where there are contradictory symptoms like patient with all signs of kidney yin deficiency but experiencing intense internal feeling of cold, or shall we say false cold in true heat, or of underlying kidney yang deficiency but experiencing hot flashes, tongue body color is a reliable indicator. So let us remember this. Normal tongue shape changes only when pathology persists over a long period of time. Pale, swollen tongue body shows that qi in the body has been deficient for quite a while. It indicates that the qi is not only failing to bring blood to the tongue, hence making the tongue body color into pale, but is also failing to transform and transport the fluids, making the tongue body into swollen. Okay? Red tongue with a small contracted body may reveal kidney deficiency with a severe loss of fluids. This combination of color and shape is indication that yin has been exhausted over a long period of time. Yin deficiency has given rise to heat, which in turn has injured the fluids, eventually leading to contracted appearances of tongue body. Okay? Thus, the combination of tongue body color and shape provides precise information about condition of qi, blood, yin yang, and fluids. In the case of chronic illness, it is important to use the results of this diagnostic procedure to assess severity of the illness. In relation to the 8 principles, the tongue, body color, and shape reflect the state of yin and yang, as well as the presence of heat and cold. Yin deficiency produces heat, represented by a red tongue body, and in severe cases by a contracted body as well. By contrast, internal cold that develops with yang deficiency is reflected in a very pale, swollen tongue body. Again, the tongue body color and shape are important indicators when assessing chronic illness. Cracks, depressions, and localized swellings on tongue body reflect energetic disharmonies in the specific organs. For example, if anterior third of the tongue is noticeably swollen, this implies retention of phlegm in the lungs. In such a patient complains of a cough, it must be given immediate attention. However, if there are no lung symptoms, it is of no special significance and should just be noted. Okay? Sometimes the tongue does not reflect a pattern of disharmony. This is especially true to patterns involving the liver. It is advisable to differentiate a pathology caused by ascending liver yang or liver fire based entirely on specific tongue sign, namely redness or red points on the side of the tongue. Accurate diagnosis is possible only by considering pulse qualities in conjunction with symptoms experienced by the patient, since both of the aforementioned tongue signs can denote ascending liver yang as well as liver fire. Okay? This is also the case with skin disorders. Atopic eczema does not always show up on the tongue. Patients who have suffered with long-term skin disorders manifested itchy skin, sensations of heat, and redness of skin will often present with a tongue that is pale or show no signs at all of heat in the blood. Thus, for diagnosis and treatment of skin disorders, where the most obvious signs are skin lesions, indicators on the tongue are of little, if any, importance and must be ignored. Now let's go to our patient, 41 years old. Tongue description, pale, swollen, red spots at the sides and tip, white, thin coating. Symptoms are fatigue, weight gain, bloating, no periods for 3 months, cold extremities, and frequent sore throats. Background to disease, 6 pregnancies, overwork at the office and at home, and lack of sleep. DCM diagnosis. Number 1, spleen-chi deficiency with deficiency of blood and accumulation of dampness. Why? It's because, as we can see in the tongue picture, the tongue body color is pale and the tongue body shape is swollen. Okay? The patient then presents symptoms of fatigue, weight gain, bloating, no periods for 3 months, cold extremities and frequent sore throats. All these symptoms greatly attributed to spleen-chi deficiency with deficiency of blood and accumulation of dampness, resulting from her background of having 6 pregnancies, overwork at the office and work at home, and lack of sleep. Okay? Now the next diagnosis is retained externally contracted heat. This is reflected by red spots at the sides and tip, probably liver or gallbladder heat or heart heat. And the last is normal. This is reflected by a white thin coating of the tongue. Yan lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Unless there are any questions, we will now proceed to diagnosis by interrogation. And let's welcome straight from Baguio, Ma'am Vina Pascual. Good afternoon po, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, continuation po ito, the other day, mental, emotional symptoms, day 2, how we asked. Paano tayo magtanong? As mentioned above, we must use great sensitivity pag nagtatanong po tayo sa mga patients about their emotions. Una, we should ask only pag ang itsura po nila ay willing to talk about their emotion and respetuhin po natin their wish if pag ayaw po nila na gawin. So, yung emotional stress ay sanhi po ng problem. So, ang tanong dito dapat ay, have you suffered any shock in the past? Ganun po. Then, or pwede rin, do you tend to feel irritable about some situation? O maaring, do you sometimes feel sad? At saka iba pa. Ganun po yung dapat na question. Of course, yung patient comes to us specifically for an emotional condition. Yung questioning po is conducted differently as the patient pag mag-open siya or mag-volunteer siya sa information. The emotional states discussed are number 1, depression, number 2, fear or anxiety, number 3, irritability or anger, number 4, worry, number 5, sadness and grief, number 6, excess joy, and number 7, mental restlessness.
Yes, Ma'am Bina. Kasi diyan po pa lang malalaman natin anong organ yung affected. Kasi di ba may mga organ
Opo.
po yung emotion.
Opo, ma'am. So number 1, depression is a very common symptom in Western patients, even though some patients may not admit to being depressed and others may not even recognize na meron silang ganito, na depressed sila. So ito po ang definition ng depression. Depression is a modern Western term which indicates a change in mood ranging from a very mild feeling of despondency to the most abject depression and despair. Pag mild po yung depression, the change in mood varies and is not permanent. Whereas pag matindi na po yung depression, yung pagbabago po ng mood is fixed na and persists over a period of months o kaya taon na.
May share ako sa ganyan, Ma'am Bina, kasi yung isang pasyente ko, hindi
Sige
pa
po,
siya
ma'am.
makamove on sa buhay niya eh. Nung tinatanong ko po, pinapakita niya masaya siya, pero deepen pala, ang sakit ng pinagdadaanan ng buhay niya. So hindi talaga siya nag-o-open muna na marami siyang malungkot, kundi masaya yung pinapakita niya. So pinabayaan ko lang, sabi ko hindi siya ready magsalita. Pero kitang-kita na sa dila eh. Pero yung ayaw kasi niya magpagamot din, ang nagtutulak sa niya magpagamot yung tita niya kasi ayaw niyang alagaan pag na-stroke kasi prone na siya sa stroke, puro na purple yung dila eh. Yun po
Opo.
yung denial stage pa niya. So talagang hinayaan lang muna kung di siya ready. Pero bandang huli nag-open din po siya.
Very good. Okay po, ma'am. So tuloy po natin. Severe depression is also accompanied by characteristic changes sa behavior, attitude, yung pag-iisip, deficiency, and physiological functioning. Of course, a temporary feeling of depression following adverse life events such as bereavement ay normal po. In distinguishing a normal reaction from pathological depression, a quantitative judgment has to be made. If the precipitant seems inadequate or the depression appears parang ano na po, matindi na po or sobra na or too long-lasting at matagal na, yung condition po may be regarded as abnormal. And idagdag po natin, the severity and incapacity in depressive illness differ qualitatively as well as quantitatively from depressed feeling, which are part of normal experiences. Depression is twice as common in women as in men, and its onset increases towards middle age. The main symptom of depression are depressed mood, loss of nawawalan na po siya ng interest. Tapos nawawalan na siya ng self-esteem or motivation. So nagkakaroon siya ng fatigue, anxiety, insomnia, at saka wala na po siyang ganang kumain. At sa mga very severe cases naman, yung patient never comes out of an extremely depressed mood, is unable to experience any pleasure at any time, is in utter despair, and maybe suicidal na po. A major depressive syndrome has the following characteristic. So yung mga ganito po, parang may red flag na. Very depressed mood most of the day, nearly every day. And then markedly diminished interest or pleasure na in all or almost lahat ng activities most of the day at araw-araw na yan. Significant weight loss or gain o nabawasan or nadagdagan in appetite. And the next ay insomnia or sleepiness. Next naman ay psychomotor agitation or retardation araw-araw. And then araw-araw din na fatigue. So nakakaramdam din si patient ng feeling of worthlessness or guilt, which may be delusional nearly every day and not merely self-reproach lang or guilt about being ill. Diminished ability to think or concentrate, indecisiveness, or nearly everyday din. Recurrent thought of death, recurrent suicidal ideation without a specific plan or suicide attempt or a specific plan for committing suicide. At idagdag para natin dito yung above manifestation. A major depressive syndrome is defined as the absence of the following inorganic factor: a normal reaction to bereavement, delusion or hallucination in the absence of mood symptoms, at yung schizophrenia. Ito yung serious mental condition. Delusional disorder at saka psychotic disorder na po. So yan lang po. Thank you, Doctor. Thank you sa lahat. Thank you, Ma'am Mildred, sa pagdagdag po.
Pag hindi pa masyadong matindi, ma'am, pwede pa natin i-acupuncture para maagapan na hindi na maging talagang siraulo.
Opo.
Yes. Thank you very much. Marami pa tayong aaralin dyan, no? Mahaba-haba. Thank you very much, Ma'am Vina. And now let's proceed to Paul's diagnosis. Good afternoon, Ma'am Mildred.
Good afternoon po muli. So, pagpatuloy po natin ang ating pag-aaral sa pagpupulso. Pulse diagnosis, number 85 na po tayo, the 3 position. So, ito po, Nanjing, the classic of difficulties. Ito po yung pinagkuhan ng ating book. The pulse position are defined by the channel pairs in relation to 5 phase or Xiang cycle. So, babalikan po natin. Yung level 1, pag sa tune, ito yung superficial. Sa left na side po, mararamdaman natin ay yung small intestine. Saka right naman po ay large intestine. Ito po yung sang organ. So, pag diniin natin sa tune part, ito po ay makakapan natin yung heart kasi partner organ niya yung small intestine. Then sa right is lung, partner organ ng large intestine. Then next is one, ito yung sa gitna pong part ano. So sa left side, pag dininan natin ang superficial level, yung pinatong lang yung kamay, so yung isang organ po ang makakapan natin itong gallbladder. Then right is stomach. Then pag diniin natin, deep, liver, sa left, then sa right is spleen. So, lagi lang po sila magkakapartner. Liver and gallbladder, spleen and stomach. Pag nasa ibabaw, yung ay zang organ, pag dinin mo ay fu organ. Then sa chi, superficial, urinary bladder sa left. So, sa right is sanjiao or triple burner. Pag dininan mo deep, kidney. And then sa right is pericardium. Yan, sinasa ulo po yan. Kailangan sa uluhin. Okay? Sa Mai Ching, the pulse classic naman po ang pinagkuha ng book, Wang Zhu, He, 280 CE. The pulse position are also distributed in relation to 5 phases. In this model, the organ rather than the channels are evaluated. So, mas organ po ang tinitingnan than channel. This is because this book focuses more on interpreting the pulse in relation to treating the patient with herbs rather than needle. So sinasamahan po ito ng mga herbal instead of needle. So the internal organs are more relevant than the channel. So tinututukan yung mga internal organ. So pag tune po level, superficial sa left ay small intestine, right is large intestine, deep is heart, and right is lung. One, superficial level, left is gallbladder, and right is stomach. Deep is liver, left, then right is spleen. Sa chi level, superficial is left urinary bladder, right is sanjiao, deep is kidney, and right is pericardium. Madali lang naman po yan sa uluhin kasi magkakapartner organ lagi po yan. So, Bin Hu Mei Zue, the study of pulse by the Bin Hu Lake Master, Shilin Zhen, 1564 CE. So, ang model na po to is no distinction between the superficial and deep level. And it is mainly the Zhang organs that are being diagnosed. So, yung Zhang organ po ang tinitingnan. So, sa tune, tinututukan po niya sa left is heart and the right is lungs. Sa guan, liver, and the right is stomach and spleen. So sa chi is kidney, both kidney po yan. So mas madaling sa uluhin yan. Pag Jingyu Xuanzu, Jingyu complete sa book po ng Zhang Jivin, 1624 CE. Here, it is not necessarily the Zhang organ, but that is deepest or the fu organ that is most superficial. So, mas fu organ po ang tinututukan dito. This is the model that is mainly utilized in TCM style Chinese medicine. Example po dito, model utilized sa mainland China today and also in much of Western world. So, pag tune pang ginamit nila, yung left is heart and chest ang napapalpate. So, sa right is lung and chest. Pagwan naman, ang mapapalpate nila is liver and gallbladder. So, stomach and spleen, magkakapartner pa rin naman sila. Sa chi naman, yung level ng chi, kidney, urinary bladder, and small intestine. Sa right is kidney and large intestine. So, pag iba-ibang book, iba-iba din yung kanilang presentation ng pulse position, pati yung mga organs. Okay. The right chi position is perceived as representing kidney yang, whereas the left chi position is seen reflecting the condition of kidney yin. So, pag right is yang and left is yin, yung yin and yang ng kidney. Although all these different models can appear to be confusing and contradictory, there is logic in different systems. Common to them all is the fact that the three positions represent the upper, middle, and lower aspect of the body. There is generally consensus with regard to most of the organ and channel position. As written earlier, some people initially choose only to utilize one model, for example, the model used in modern China, and learn this position by heart, whilst keeping in mind that there are other models that could also be relevant. So yun nga po, iba-iba yung book na ginagamit, iba-ibang model. So gumamit na lang po tayo nung talagang model na nakasanayan na rin natin kung ano yung pinapractice natin sa clinic at saka yung tinuro ng mga school natin. Kasi kung paghahalo-haluin po yan, minsan nakakalito kasi iba-iba rin yung mga organ. Ganun po siya. Okay po. Pero more or less, halos tayo naman dito sa Pilipinas po, parang para yung ginagamit natin.
Yeah.
Kasi pag iba-iba, Doc, mag-iba-iba din yung diagnosis. Ano, Doc? Pero almost yung mga kasum natin, parang pare-pareho naman tayo na ginagamit.
Totoo. Anyway, kung saan ka medyo comfortable, yun na lang gamitin mo. Hindi lang naman puro pulse lang yung basehan natin.
Okay, opo. Pang-supplement lang naman po yan eh. Tongue, pulse, mag-ano sila, magtutulungan.
Yeah, so thank you very much, Ma'am Mildred. Kung wala na pong questions, we will proceed to pulse differential diagnosis. Let's welcome Ma'am Nitz Yu. Good afternoon po, Ma'am Nitz.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc? Di ba maingay?
Hindi naman maingay. Okay naman
Ay,
yung
salamat.
audio.
Wag sana mawala yung net. Medyo mahina. Welcome to our TCM Foundations number 186, Stagnation of Cold in the Liver Channel. Okay? Etiology, invasion of exterior cold. Okay? Underlying and or accompanying pathology, invasion of the liver channel by cold, lamig, okay? Sign and symptoms, fullness and distension of the hypogastrium with pain, may sakit, which refers downwards to the scrotum and testis and upwards to the hypochondrium, alleviation of pain by warmth, pag pinainitan, wala ang pain, straining of the testis or contraction of the scrotum, bright white complexion, green, blue, or purple lips, vertex headache, a feeling of cold hands and feet, vomiting of clear watery fluid. Observe niyo po yung binabomit niya. Copious clear urine, loose stools. In women, there can be shrinking of the vagina. Meron palang ganun. So, when you palpate the pulse, it is deep, wiry, or slow. Okay? Yung tongue, kapag tiningnan nyo, makita nyo ay pale and wet with a glossy, makintab, white coating. Okay? So, treatment principle, warm liver and dissipate cold, rectify chi, and stop the pain. Okay? Acupuncture treatment points, we're going to use REN 4, scatters cold in genitals. Spleen 6, warms liver, nourishes the blood. Liver 5, scatters cold from liver channel, liver 5. Liver 3, forces the liver chi. Okay? REN 6 or CB6, warms the lower burner. REN 6 or CB3, scatters cold from lower burner. Ikakalat. And liver 1, clears liver channel. Okay? needle, ang technique na gagamitin natin ay sa needles ay may drainage. Moxa pwede rin gamitin in large amount if there are significant cold signs. So, cold, kaya may moxa. Okay po? Thank you very much, Doc Hector. Thank you very much, everyone.
Thank you very much, Mom Neats.
Thank you.
Enjoy your stay there.
Thank you, Doc.
Thank you so much. Kahit busy talagang nag-present pa. Next, punta na tayo ngayon sa acupuncture patterns and practice. And we are going to continue where we left off yesterday. So topic is still abdominal pain. Now let's talk about clinical manifestation and key points of analysis. The abdominal pain may be acute and short-lasting, or pwede rin chronic and long-lasting. It may be distending, vague, stubbing, twisting, or colicky, or burning in quality. So let's differentiate acute from chronic. Pag acute abdominal pain tends to begin abruptly and be severe. So mas malala siya. There often are prominent accompanying symptoms. Acute abdominal pain is usually due to attack by exogenous pathogenic evil, intemperate diet, or parasitic infestation. Ang chronic pain begins slowly, prolonged po ang course niya, and it is not very severe. It is usually due to internal injury, gelling of formless pathogenic evils, katulad ng colder heat, okay, pwedeng meron kang chronic illness, or deficiency of Yang with cold in the visceral organs. Quality of pain. Okay. Cold-induced abdominal pain, may urgent quality siya, severe siya, and meron pong borborygmus. Meron kang naririnig na concerto sa ano mo. If the pain is due to strong exogenous cold, it may be accompanied by chi stagnation and vomiting, and tends to be acute. So talagang nagsusuka ha. Meron siyang distending and firm quality. If the pain is due to deficiency cold, so alam nyo na yan, Yang deficiency, no? It is continual and persistent. Next, pag heat-induced naman abdominal pain, it is mainly peri-umbilical, nakapalibot sa ating umbilicus. It often has a feverish quality. So it may be accompanied by constipation and preference for cold drinks kasi nga heated, no? Chi stagnation. Abdominal pain in chi stagnation tends to fluctuate in severity and migratory. Yan po ang characteristic ng chi stagnation. Palipat-lipat, no? There are chest and subcostal discomfort, eructation, and abdominal distension. Passing of gas usually brings temporary relief. Blood stasis. Abdominal pain due to blood stasis, fixed po ang location, and character is stabbing. There is guarding. Ayaw niyang pahawak ng kanyang abdomen. No? It usually worsens at night, usually accompanied by dusky complexion. So if you look at the complexion of the patient, medyo dusky siya, and then cyanotic ang lips. No? Overindulgence or indigestion produces abdominal pain with eructation. The pain is alleviated by defecation. Abdominal pain due to deficiency is chronic and often persistent. There is no guarding. Sometimes there is preference for pressure. Gustong-gusto nila magpamasahe, no? And then gusto nila yung hard talaga. Kaya very deficient po yan. Okay? And ito nga pag may eructation, medyo maingay sila, no? Ito yung I've met a lot of therapists na ganon dahil siguro pagkain nila hindi na tama. may mga talagang nag-eructate, nagbe-belch. Belching po ang eructation. Okay? So abdominal pain due to pathogenic evil strength is acute and abrupt, so excess po ito, often accompanied by abdominal distension, vomiting, and guarding. Now let's go to location of pain. Abdominal pain between the lower ribs and the umbilicus relates mostly to spleen, stomach, and intestines. So periumbilical pain that fluctuates and sometimes becomes prostrating is often due to heavy parasitic infestation. So marami kang alaga. Often there is vomiting of yellow-green fluids or of parasites. When the pain subsides, so kailangan mo na talaga nito ng anti-parasitic. When the pain subsides, the appetite returns to normal. Pain due to parasitic infestation is most commonly seen in children. Abdominal pain below the umbilicus on one or the other side or on both sides relates mostly to illness in the liver meridian. Abdominal pain below the umbilicus that comes in recurrent attacks, often accompanied by spasm or firm masses, relates mostly to disease in the kidney or urinary bladder. So I hope helpful po yan, no? Now let's go to acupuncture treatment. Marami pong causes ang abdominal pain, and each cause will produce a different clinical picture. So acupuncture treatment uses the basic approach of harmonizing the intestines and the stomach. Kasi ano yan sila Yang, no? And regulating the qi, you have to regulate the qi para masuppress yung pain. The most commonly selected acupoints, you can never go wrong with this. In fact, favorite po ito na points. CV12, CV6, stomach 36. No? Treat abdominal pain due to cold strength. So by warming the middle jaw and dispelling cold. Okay, so you have to use moxa. Add the acupoints, stomach 21 and CV8. Reducing method po and moxa. For REN 8 or CV8, you have to do amoxibustion with salt. Okay? Lagyan mo ng maraming salt. Treat abdominal pain due to deficiency cold, so Yang deficiency, no? You warm the middle jaw and augment the qi. Add the acupoints, liver 13, stomach 25, and CV4. So since this is Yang deficiency, you do reinforcing method and moxibustion. Treat abdominal pain due to qi stagnation by unblocking the liver and regulating qi. Add the acupoints, pericardium 6, liver 14, GB 34. Apply reducing method. Treat abdominal pain due to blood stasis by promoting blood circulation and activating the channels. Add stomach 28 and liver 14, reducing method. Treat abdominal pain due to accumulation of dampness heat by cooling heat and relieving accumulation. So add natin yung acupoints, stomach 25, stomach 37, spleen 6, and spleen 9. We apply reducing method. Okay? Thank you very much. Are there any questions? So I think
May share ako, Doc, dun sa ano po ng mga parasite. Kasi may naging pasyente po kong bata. Ayaw minom ng gamot na pampurga, pero talaga po ang laki-laki na nandiyan. Sabi ko talaga merong parasite, gumagalaw pati eh. Ang ginawa po namin, yun, acupuncture po. After ng acupuncture, pinalaga ko po yung nanay niya ng red na kamote, yung red pong talbos. Pina-everyday ko po yun mga 3 days. Alam mo po, lumabas lahat ng parasite niya.
Talaga? Amazing.
Opo, natural pong pang ano siya, purga yung talbos ng kamote na pula. Papahigo po dun sa bata. Asin lang pong konti ang halo.
Ang galing.
Tapos,
Congratulations.
through acupuncture. Lalaki, lumabas po talaga. Hindi naman siya buhay. Tulog na siya.
Inalagaan mo.
Ginawang spaghetti.
Yeah.
Pero po talaga, maganda po siyang pang natural na pampalabas ng mga bulate.
Mhm.
Karanasan po namin.
Thank you very much po, Ma'am Mildred, for sharing. Any other questions? Okay. So ngayon, we will listen to Ma'am Teresita Sumile for signs and symptoms. This time, she will talk about purple lips and bluish-greenish lips. Good afternoon, Ma'am Teresita ulit.
Good afternoon ulit, Dr. Hector and classmates. Now let's talk about purple lips. In blood stasis, purple lips, dark complexion, I know. In blood stasis, signs and symptoms po are purple lips, dark complexion, headache, chest, hypochondrial or abdominal pain, palpitations, purple tongue, wiry pulse. Other symptoms and signs depend on the organ involved, which may be the liver or the heart. Okay? In severe spin-yang deficiency with empty cold, signs and symptoms are purple lips, pale complexion, poor appetite, slight abdominal distension after eating, abdominal pain, tiredness, lassitude, weakness of the limbs, loose stools, feeling cold, cold limbs, pale and wet tongue, deep weak, and slow pulse. In severe kidney yang deficiency with empty cold, signs and symptoms are purple lips, dark complexion, lower back ache, cold knees, feeling cold, bright white complexion, weakness, tiredness, lassitude, abundant clear urination, urination at night, impotence, decreased libido, pale and wet tongue, deep weak pulse. This is a severe deficiency of kidney yang with internal empty cold that leads to some blood stasis. For this reason, the complexion is dark rather than pale, as it should be in yang deficiency. In internal full cold, signs and symptoms are bluish purple lips, bright white complexion, feeling of cold, cold limbs, abdominal pain, bright pale complexion, thick white tongue coating, deep full tight slow pulse. Other symptoms and signs depend on the organ involved. Next is turbid phlegm in the lungs. Signs and symptoms are bluish purple lips, sticky taste, breathlessness, expectoration of phlegm, wheezing, inability to lie down, a feeling of oppression of the chest, sticky dirty tongue coating, and slippery pulse. In heat at the nutritive chi or blood level in acute febrile diseases, signs and symptoms are reddish purple lips, fever at night, mental restlessness and confusion, macular rash, bleeding, red tongue without coating, and fine rapid pulse. Next is bluish-greenish lips. In internal cold, signs and symptoms are bluish lips, bluish white complexion, feeling of cold, cold limbs, abdominal pain. Other symptoms, including those of the tongue and pulse, depend on whether it is full or empty cold and also on the organ involved. Next is stagnation of chi and stasis of blood. Signs and symptoms are greenish lips, greenish complexion, abdominal distension and pain, irritability, chest pain, purple tongue, wiry or choppy pulse. Chi and blood stagnation of the heart, lungs, stomach, or liver may cause greenish lips. Other symptoms and signs depend on the organ involved. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Okay, so now we go to atrophy syndrome. And let's listen to Ma'am Vina Pasqua straight from Baguio. Good afternoon po ulit, Ma'am Fina.
Good afternoon po ulit, Doctor. Good afternoon po sa lahat. So, atrophy syndrome po. Day 2, pathology po tayo. Pathology. Atrophy syndrome is not usually caused by a single factor but results from a combination of factors. For example po, yung invasion of external dampness together with irregular diet and shock. Another example of a combination of factors could be the invasion of external dampness together with sobra po yung sexual activity or overwork and a trauma. The main patterns appearing in the atrophy syndrome are as follows. Ito po yung heat in the lungs, ensuring yin fluids, full type po yan. And then invasion of damp heat, full type then. Invasion of cold dampness, full type. Next ay stomach and spleen deficiency, empty type. Spleen and heat, heart collapse, empty type po. Liver and kidney deficiency, empty type. Blood stasis in the channels, full empty type. So dito sa nakikita natin yung full and empty patterns of atrophy syndrome, ang duration, onset history, main symptoms, and other symptoms. Pag full po, short duration, and then pag empty, long po. Yung onset naman, abrupt onset pag full, rapid development. Pag sa empty, gradual, so biglaan. Gradual onset. History of invasion of external dampness or living in a damp place, pag full. And then pag empty naman, developing from full types in patients with weak constitution. Then ang main symptoms, weakness of limbs, difficulty in movement, no atrophy sa full, tapos sa empty, weak limbs and atrophy. So yung other symptoms, pag full, numbness, pain, even convulsions. So example yung mga polio. Sa empty po naman, no pain, except in blood stasis in the channels. The pathology of atrophy syndrome is characterized by fullness in its initial stage and either emptiness or a combination of fullness and emptiness in the middle and late stage. Thus, the first three of the above patterns usually appear in the beginning stage of the disease and the others sa middle late stages na. The full patterns inevitably change into empty patterns with time. For example po ito, lung heat nagde-develop po into liver kidney deficiency. And next ay damp heat nagde-develop into stomach and spleen deficiency. And then next ay cold dampness develops into stomach and spleen deficiency. The reverse is also possible. That is, deficient patterns can give rise to excess ones. For example, stomach spleen deficiency may lead to dampness. And then ito naman, kidney liver deficiency may lead to blood stasis. Pag full and empty patterns of atrophy syndrome are differentiated. It is very common, especially in the middle-late stages of the disease, to see a combination of full and empty patterns. For example, damp heat and stomach spleen deficiency. Then cold dampness and stomach spleen deficiency. Next ay stomach spleen deficiency and heart spleen collapse. Then another is stomach spleen deficiency and kidney liver deficiency. And then kidney liver deficiency and stasis of blood in the channels. There is a correspondence between etiological factors and patterns as follows. Excuse me. Pag wind heat in a warm disease causes only one pattern, that is that of lung heat enduring yin fluids. Pag external dampness, it leads to damp heat or kaya cold dampness. Pag regular diet causes the pattern of damp heat, cold dampness, and stomach spleen deficiency. Pag excessive sex naman and overwork, it causes the pattern of kidney, liver deficiency, and blood stasis in the channels. Itong trauma causes the pattern of blood stasis in the channels. And then itong shock leads to the pattern of heart spleen collapse. Relationship between etiological factors and patterns. The symptoms and signs of atrophy syndrome may have some similarities with those of painful obstruction syndrome and wind stroke. Although yung tatlong condition na ito have very different pathologies from the point of view of Western medicine. Pero sa Chinese medicine, there are similarities. In particular, if we consider the beginning middle stage of atrophy syndrome and compare its symptoms with painful obstruction syndrome and wind stroke, we see that yung tatlong condition na ito are characterized by obstruction of muscles, sinews, and channels by pathogenic factors. So dito nakikita natin yung etiology at saka pattern. So sa etiology, toxic heat, sa pattern, heat in lungs, stomach. And then external dampness, maaring damp heat, cold dampness, o kaya damp phlegm. And then irregular food intake, damp heat o kaya cold dampness, or damp phlegm, stomach spleen deficiency, at saka spleen heart collapse. Pag excess sex naman, spleen heart collapse, and then stasis of blood in channels. Pag accident naman, ito ay stasis of blood in channels. And then yung shock, spleen and heart collapse po. So yan po ang relationship between etiological factors. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Okay, any comments? Ma'am Mildred? Anyone?
Okay na, Doc. Malinaw po.
Oo. Medyo marami lang talaga siyang patterns. But anyway, we will be taking them up next week, no? So again, we would like, for wala ng questions, we would like to thank all of our presenters and hope to see you again next week. Thank you, everyone. And
Thank you po.
good evening.